everyone. Today I'm going to share about my experience in the clinical physician camp which just ended last week. And today I will separate my presentation into 5 parts, introducing the clinical skills and other courses we take at first. And then we'll went to the white coat ceremony, which is really surprising. The next part is we experience being uncle, and it's really a shocking experience. And then is the model OSCE we take on the 4th day. And at last, I'll share about my reflection in this camp. So let's get started. In the camp, we have a lot of courses teaching us some clinical skills or some skills to communicate. And we can also really touch a lot of medical tools and equipment that might cost a lot. The first one I want to introduce is the ultrasound examination. The ultrasound examination is widely used today in the medical industry because you can see that the machine is really small and simple, and it's portable, and it can help find out some problems in your body. With this transducer probe in my hand, you can look at your body inside with the color black and white, and you can see organs, a lot of organs or vessels inside. And we also tried other clinical skills such as putting the nasogastric tube into the model. There are a lot of processes you need to be careful of, and in some other courses you need to be careful if there's germs, or you have to wash your hands or put on the gloves before you touch those equipment and tools. And this one is we tried the intravenous injection, and this is also the model hand. And inside the hand there are really the water colored in red. And this one is difficult to recognize, but that is me wearing the protective clothing, which all the workers, the medical staff has to wear during the COVID. And what I'm doing is putting the endotracheal tube inside the model. And this one, can anyone guess what that is?
VR.
Yeah, that is VR. I'm wearing the VR device to look at, you can see on the monitor, that's a body, and you can look at the structure inside. You can choose whether you want to look at the bones, or the nerves, or the vessels, or the skins. And you can even just go forward to go inside the body and see the structures inside. And then is the white coat ceremony at the end of the 2nd day. It is really surprising because this ceremony isn't written down on the schedule. So we didn't know what we're going to do until we step into the room with dim light and very cold air, which makes a very good atmosphere. In the white coat ceremony is what all the medical students would have in their 4th grade. And in the ceremony, the doctor helped us put on our white coat, which symbolized the duty of doctors. And then together we read the Hippocratic Oath. And at the scene, it's really touched, and a lot of my friends also say that they are looking forward to this ceremony if they really have the chance to get into to become a medical student. And then is the very exciting and very shocking experience of being uncle. This is also a course that is not written down on the schedule. So there are SP there. SP stands for standardized patient, which are actors trained to act like a patient. But the SP that day are not really easy to communicate. I will show you later. There are a lot of words, and because being on call means that you have to turn on your phone and then wait for someone to call you to deal with the problem, to deal with emergency, or to take care of the patients. And the day when we're called to the ward, I was randomly pushed into a ward with another student. And the one on the right is the SP. Our task there is to ask him to put on the bracelet with his name and the number on it, and also ask him to wear the patient's clothing. However, he keeps saying that I am VIP, everyone here knows me, I don't want to put them on. And we have to communicate patiently with him. And the other very impressive one is this man. This patient acts as a person who drank a lot. And he kept shouting there, and he was very impatient. He has a wound on his arm, and our task is to help him deal with the wound. However, he kept saying that, I'm not painful, I don't need your help. And that's how you feel, not me. And at last, he just told us to get out. So that's really a shocking experience at the first scene, but we have to calm down and we have to show our confidence, and we also have to comfort the patients. On the fourth day, we have the model OSCE. OSCE stands for Objective Structural Clinical Examination, which is an exam. Yeah. And it contains 4 parts: history, taking, physical examination, which is like this. This is to examine if there's a problem with your nerve. And then the clinical skills we learned before. And we have to give our initial diagnosis. There are 4 words, and 2 with the SP inside, and the other 2 with a model and an examiner inside, just this, like this, a model and an examiner. And before going into the word, we have to look at to read the instruction and the information about the patient outside the door for 1 minute. And then when the bell rings, we go into the word. The first patient I met is this. He is an SP, and he said that he has some problem of abdominal pain. So I have to give him some examination, some physical examination, to find out that he really has the problem on the right upper quadrant of his abdomen, in the right upper quadrant. And the most common problem for this is the cholecystitis. At last, I would like to share my reflection in these 5 days. In the 5-day camp, we really learned a lot of skills. We know what doctors are actually doing. We also learned how to CPR and use AED. And then we can even touch the model that cost over $5 million. Yeah, his name is Anthony, and her name is Annie. Yeah, the model has their own name. And also, in our camp, there are only 20 students. However, there are about 6 or 7 students who is now studying abroad or who live abroad. So it's really an international environment. There, you can often hear others chatting in English, and sometimes I'll join them. And sometimes even in the classes, the teachers, the doctors would try to use English to explain for them. This is one of my roommates called Claire. She was born in the USA and she lives in the USA. And this one on the right is my best friend in this camp called Hedy, and she is now living in Lithuania. And yeah, because there are so many people from other countries, we can chat with them about our school lives or our different culture, or even what they eat for lunch, and that's really interesting. And also I can learn some English of the organs. And also, what the most important thing I learned is that the doctor's life also varied. Before I listened to the speech of this doctor, I thought that the doctors are always overworking and very tired. However, this doctor, he is from the emergency department, and at the first sight, he looks just like an athlete instead of a doctor. He shared a lot about his life outside of hospital. He said that he wasn't a doctor who liked to stay in the hospital. However, he liked to do a lot of extra activity when he's off work. So that's how I understand that a doctor can also have his or her own choices of how to live a life. And in this camp, after this camp, I think what I get is that now I know what to do and I know what I'm doing for. That's the end of my presentation. Thank you.